All right, I'd like to tell you something about adult ADHD that is related to late sleep. We studied late sleep in adults with ADHD. It's a disorder that is already starting in childhood, and it's prevalent in around 80%. It means adults with ADHD have a late chronotype. They prefer to go to bed late and to rise late as well. And you might ask, why is this a problem? If you prefer to go to bed late, why is that bad? Well, the problem is that most people don't get enough sleep because they have to get up for work, for school, for children, and they only have 5 to 6 hours of sleep a night. Research in internal medicine has shown that if you sleep only 5-6 hours a night in the long run, you will easily develop obesity, hypertension, diabetes, and other chronic metabolic disorders. So it's a bad habit for health in general. So once we found out that ADHD patients slept so bad and so short, we got concerned about their health in general as well. And we studied at PsyQ in the Netherlands the melatonin onset, which proved to be delayed in 80%, 90 to 100 minutes later than normal. And it means that people really can fall asleep much later than normal. So their sleep is not being supported by the sleep hormone itself. Not only the melatonin is late, also their movement pattern is delayed and their temperature pattern is delayed. And these all have an interplay together for the circadian rhythm that we're talking about. Of course, these people are tired during the day, which aggravates their inattention problems that belong to ADHD. So what can we do about it? We thought about phase advancing the sleep, so making them sleep earlier. We can do this by providing melatonin as a tablet, for instance at 10 p.m. in the evening. But you can also phase advance the sleep phase by adding light in the early morning. So pretending it's summer morning, even in winter. And the light will wake you up and will decrease melatonin production so that you can wake up. And maybe by doing both things, prescribing melatonin in the evening and light in the morning, we can more effectively set the sleep phase at an earlier time point and ensure that the patients get 8 hours of sleep instead of 6. Because we assume that having only 6 hours of sleep is a metabolic risk in the long run for diabetes, obesity, and even cancer. So we think it's important to study the circadian rhythm in adult ADHD in a way to prevent chronic diseases in the future.